how do you think money could be spent better for private and public healthcare? Like, what could it go to better benefit it?
Um, I'll spend more money on better equipments like beds, tubes, all that stuff, a better quality, and structure. Definitely make hospitals bigger and more of them.
My name is Emma Ty. I'm with Tomas Musi, and today we're going to be talking about the health status in Paraguay. So tell me, how do you know me? Introduce yourself to.
We know each other from the rugby team. She's in the women's rugby team, and I'm in the men's rugby team. So basically that.
You were born in Paraguay, right?
Yeah.
Growing up, how was healthcare for you and your family?
It was pretty good because from the beginning I was in a private hospital, so it was not a problem. Public hospitals are not the best.
And so your family, you guys do have private healthcare?
Yeah.
Okay. What are some of your experiences with the private healthcare system?
Well, they're not the best ones like here, of course, but I never had a problem at all. Like the waiting times probably is a problem over there. The stuff, we don't have a lot of people working. We don't know why. Maybe, I know doctors go to other countries to work because they get paid better, but that's mainly the problem.
Okay. And are you religious?
No.
Do you think like people with religion doesn't have problems with their healthcare there?
No, there's not restrictions or complications for them at all.
Okay. How do you think Paraguay could improve their healthcare system?
Well, transportation is a problem, so I'll change that. Definitely, it takes forever for ambulances to get wherever there's an emergency. Then make more hospitals. We don't have enough. Whenever COVID hit it, there was a lot of problems with that. People was dying because we didn't have enough beds or rooms for people. People were in their hallways waiting for their turn. Also, the equipments are not the newest ones, yeah. So they're old and sometimes they don't work well, so yeah.
So I did learn that like Paraguay is very understaffed and that even in like rural areas, it's very hard to get healthcare, like transportation, like ambulances. So like and that like they'd rather just drive their own vehicles. What do you think they could do to help with that?
Well, I was talking about not having enough hospitals in the capital. So in the rural parts, like in the interior, like on the north, that there's not too much people living there. Only 3% of the population. It's pretty bad. So people just gotta drive like hour, 2 hours and a half to get to a hospital. Sometimes ambulances don't get there, and whenever there's an emergency, that's a big problem. So what I would do is build a hospital at least at every city or little town we have, or maybe have one in the middle of a few towns in the north. Have more hospitals in the capital, of course, because there's where more population is. So, yeah.
So like, how do you think? I feel like maybe the education out there is that probably like affect why it's so understaffed. Like maybe they're not being taught enough, or they lack resources for it. Do you think that plays anything in there?
Yeah, education could be a problem because schools are not the best, college is not the best. So yeah, that could be a problem why we don't have enough people working in hospitals.
And then I also learned that in Paraguay, you guys only have like 2 mental like health hospitals, but there's about like 9,117 people that suffer from mental health. So you guys don't have the resources for that.
I think it's not the resources. Well, it is the resources, but they don't put too much focus in that. Like they prefer to, I don't know, focus on hospitals more to emergencies and stuff than healthcare or mental health.
And then, although Paraguay is an upper middle income country, why do you think basic health services are lacking?
Well, corruption is a big problem over there. The government and some rich people just, like I said, they oversell products to hospitals way more expensive than what they are to keep money for themselves. So our provider sells tubes to the hospital for way more money than what it is. So the government pays them more, and they get it for themselves. They try to take advantage from it, and that's the reason.
Okay, so like, what are some really big health problems that have like impacted Paraguay, and were you affected in any way?
A big problem. Well, COVID was a big problem, really, because I got an example. My mom had surgery during COVID, and it was kind of bad to get a room, even in a private hospital where we paid monthly for that. It was really hard to get a room for her, and whenever we were there was not enough stuff, and we were worried about getting COVID over there. So yeah, I didn't have any other bad experiences, but only that one.
And then what are some of the big differences from your healthcare system in Paraguay and then here in America?
Well, here everything works well. Everything is new. The technology is amazing. There's a lot of people working in hospitals. They know what to do. You don't have a long waiting time. Transportation is amazing. It's fast. Like it only takes you 5 minutes to get where you are. So that's the main difference.